Dr. Rachel here. Today I want to talk to you about bloating. So something that I see very common in my office, whether it be bloating that's primarily after meals or bloating that's constant or even pain that goes along with bloating, there's always a reason why. And I want to talk about those four main reasons that I see in my office. So number one is going to be digestive insufficiencies. So there's all sorts of mechanisms and enzymes involved in the digestion process that's vital to digesting proteins, fats, carbohydrates. And if we have a breakdown in any of those areas or we have an enzyme, insufficiency, then we can see bloating primarily after meals. This is common in somebody who has been on antacids or PPIs for heartburn for a long time, or even as simple as somebody who is always eating on the go, eating while they're standing up, eating while they're watching the news. Whatever it might be, they're in more of that fight or flight state rather than rest and digest. So, things we can work on with that for sure would be mindful eating first and foremost. So are we smelling our food before we're eating it? Are we taking a deep breath before we're eating it? Are we chewing enough? Are we just eating and focus on the fact that we're eating? All those things seem so simple, but they're very important to starting the digestion process as well as continuing it throughout. So that's something to work on, and then also getting rid of that heartburn process and really healing that in order to stop taking antacids and PPIs is really important too. Number two is going to be SIBO. SIBO stands for small intestinal bacterial overgrowth. So we can see this happen with people who overuse antacids, too many rounds of antibiotics, too many NSAIDs or steroids, poor diet, and then chronic stress are some of our biggest hitters there. So the process of that is we normally have the majority of our microbiome in our large intestine, but it can start to creep up into our small intestine because of the reasons that I just listed. And that's when we get that bloating process, because our small intestine is not equipped to deal with all that fermentation that's happening from the bacteria. The bacteria eats the carbohydrates and then in return gives off that gas production fermentation, which leads to bloating. So small intestine can't deal with it, and that's why we get bloating. It's harder to treat, harder to test for. So I always recommend, if you think that's what's going on, working with a functional medicine doctor to really figure that out. Number three is going to be dysbiosis. That's a fancy word for an imbalance in our gut microbiome. So our gut microbiome, like I've already mentioned, is this ecosystem in our large intestine of bacteria, viruses, parasites, all those things that have to live in harmony and work together and control a lot of our bodily processes. So not just GI tract, but full body health really depends on our microbiome. So the more we can focus on eating anti-inflammatory, lowering stress, eating more probiotic foods, and then getting a lot of fiber, all those things can really help build a healthy microbiome and get rid of that dysbiosis, process or ecosystem that's happening in our large intestine. Number four is going to be food sensitivities. So the five main food sensitivities that I see are gluten, dairy, sugar, corn, and soy. Those foods, unfortunately, are inflammatory for just about everybody, but for other people, there is an immune response that's happening, and that immune response is going to cause inflammation in our GI tract, which in turn leads to bloating. So we can test for food sensitivities and food allergies, but it's not really the gold standard. The gold standard in the research is actually an elimination diet. So I do that often with patients, but it's also something that you could try at home to really hash out and see if food seems to be, what's underlying the bloating process in the first place. Otherwise, working with a functional medicine doctor to do stool tests, which can give us all sorts of information on digestive insufficiencies, SIBO clues, and then what's your microbiome look like? Do we have dysbiosis? Is it a healthy microbiome or not? Inflammation, is that involved as well? All kinds of different things that the stool test can help us really figure out what, where the bloating is coming from. So those are some few tricks and tips to try and figure out the bloating. And if not, there's always a functional medicine doctor that can help you figure it out.